Hello, today I, Dr. Villanueva, and Dr. Kane will be presenting a rare clinical case study. Kimberly is a young 8-month-old baby girl of two loving first-time parents, Mrs. and Mr. J. Kimberly's parents have been in and out of hospitals since Kimberly's birth.
When Kimberly was born and the physician performed the initial newborn screening and ran blood tests, the doctors noticed something rare.
Her blood results showed abnormalities in her white blood cell count. Within newborns, the normal range is around 9,000 to 30,000. Kimberly's results showed a count of 7,000, which is extremely low.
Knowing that white blood cells are very important to our immune system because they protect us and help us fight infectious diseases. The doctors let her parents know that due to her low white blood count, she would be more prone to foreign viruses and bacteria.
Shortly after, Kimberly was sent home with her loving parents. Despite Kimberly's abnormalities, her parents expected a healthy and cautious, normal life for their baby girl. As the time went by, around the age of 4 months, her mother started noticing that although Kimberly was consuming enough food, she had the inability to digest food properly, and she also started noticing that her baby wasn't growing as fast as she should.
Mrs. and Mr. J got concerned and knew something wasn't right, so they decided to take her to the doctors for a checkup. Mrs. and Mr. J expressed their concerns, and the doctors immediately ordered several exams to check for function of Kimberly's pancreas. These exams included a secretion pancreatic function test, fecal elastic test, a computed tomography scan, and a bone marrow aspiration and a bone marrow biopsy.
After analyzing all lab reports, we observed that Kimberly has a low level of a hormone called secretin, resulting in inactive digestive enzymes and bicarbonates, which explains her poor digestion and malnutrition. Within her bone marrow biopsy, we see a low count of white blood cells, as well as lymphocytes and hemoglobin, which is leading to her schiatal abnormalities.
The baby has a mutation in the SRP54 gene. Due to this mutation, it does cause a serious severe congenital neutropenia, or in other words, shortage of white blood cells, to fight any recurrence or future infection. We believed it was Cohen's disease because it shows similar symptoms to Schwann-Diamond syndrome. They both show signs of low blood count, malnutrition, and more. However, what made myself and Dr. Villanueva conclude that it is Schwann-Diamond syndrome is a mutation within gene SRP54. When looking at this photo, we are looking at the gene SRP54 merging through the endoreticulum. On the left side, we have a function protein going through the motion. However, on the right side, you have a mutation occurring, which you can see that it's unable to fold the protein correctly. That's what's happening within Kimberly. Honestly, there isn't a cure for the disorder. However, there are some treatments that can help Kimberly and those with Schwarzenheim syndrome.
Based on matching the symptoms, treatment options include replacement of missing pancreatic enzymes to aid digestion and a special diet that includes fat-soluble vitamins. Additional treatments include blood transfusion and antibiotics.
It may be a difficult journey for the Jays now, because they found out their daughter has a rare disorder that will affect her greatly.
Thankfully, we can help Kimberly with what we know about her rare disorder and provide any vital information to her parents to help her live a balanced and healthy lifestyle like the rest of us. And that concludes our clinical case study on the rare Shwachman-Diamond syndrome. We hope all you learned something new and enjoyed our wonderful presentation.